It was difficult, but it's going to continue to be difficult in the next few weeks, few months. So let's make sure that we protect ourselves.
In his first update of the year, Quebec Health Minister Christian Dube had mostly bad news on the province's emergency room situation, which were averaging 137% capacity Wednesday, ER rates hitting a 5-year high. There have been about 10,000 ER visits a day over the last 2 weeks, and almost 2,000 of those for respiratory viruses like COVID, RSV, or influenza, roughly double the number compared to the same time last year.
Maybe COVID is not as bad, but influenza is still going up. It's still going up. And if there is a clear message on influenza, vaccination is still a possibility because we have only almost 50% of the population that is more vulnerable than above 65, 70 years old that could be vaccinated. A difference of 10-15% make a huge difference at the AR.
Dube says more people over the age of 65 are going to ERs with more complex cases.
A big chunk of those patients on the stretchers in the emergency rooms are actually patients that should be up on the wards in the hospital, but they're basically stuck in the emergency room for lack of a space on the floor.
Quebec says almost half of the daily ER visits are for ailments that aren't urgent and can be treated at walk-in clinics with family doctors. Recently, the health ministry urged Quebecers to avoid emergency rooms if it wasn't urgent and use the 811 health line or digital first-line access desk GAP.
I actually felt really unwell over the holidays, and I would have gone to the hospital if we hadn't been being told not to go to the hospital. It was a pinched nerve kind of thing, but I was like level out of 1 out of 10, I was close to a 10 in pain, and I chose not to go to the hospital because I thought they're not going to be able to help me.
Every time we ask people not to come to the emergency, we also mention that if you feel sick, if you're not well, we are there for you. We're sorry if that wasn't clear, but people have to understand we are there for the sickest patients all the time, 24/7.
The province's crisis cell unit is in place to help ease the situation, but some want solutions implemented.
If the ER is at 160%, well, you gotta share a little bit that burden. Distribute a little bit the pressure on the wards and have maybe each department on the ward take up an extra patient or an extra 2 patients to relieve a little bit the pressure on the emergency room.
Influenza cases are expected to peak mid-January, and healthcare workers returning from holidays should be back this week to relieve the pressure, but Quebec is still bracing for tough weeks ahead.
And I think that's the thing that makes us sad as Quebecers, is that if you don't feel like your hospital system or your doctor can be there for you, and there's such a huge burnout rate with the nurses, it makes us feel more vulnerable.
In Montreal, Alyssia Rubertucci, City News.